Hi, my name is Reg Snodgrass. I am a recovering mobile apologist and also the CEO of this company called Wearable World. In short, I think it's really important for us to all pay attention because I think within the next 2 to 3 years, nearly every one of our jobs will not only be impacted, but absolutely disrupted by this emerging economy. In 2007, I was at a small startup called Scout as part of the founding team, and all I heard was, no one will ever deal with these devices. No one will ever, the battery life isn't long. Reg, focus on mobile web. And nearly almost every one of those major players in the ecosystem are gone now because they didn't, take note of innovation and change and disrupt themselves. And so as we bring these companies on stage, I want you guys to pay attention specifically to the ways that they're looking to disrupt everything. Because we firmly believe that wearables is the beginning of the disruption of everything human, which includes business. So, with that being said, the first person on stage is the CEO of Transcense, Thibault. Come up here and show your stuff, show everybody your startup, all right? Let's give it.
Hi. Okay, see this campfire? Reminds me of good times with a group of friends, You share stories, you have deep conversations. And anybody that brings a step closer can actually be part of a group. But this is when conversation is possible. What if it's not always the case? My father, my mother, and my sister are deaf. I experienced firsthand how painful it is to try to understand group conversations when you can't hear well. You focus on reading the lips of the person in front of you when somebody else starts talking. So you turn your head, and you already missed a few words. But because you missed those words, you lost, and you missed the whole conversation. My name is Thibault. I'm the founder of Transcense. At Transcense, we make group conversations between the deaf and the hearing people possible. Because this is not only about my family. 360 million people in the world today suffer from disabling hearing loss. Every day, they encounter these situations. Family dinners, business meetings, out with friends. This is extremely frustrating because every day they have this problem. But this is not only for them. This is for all the people around them all the time. So that's why we're here. Peter, our CEO, is our hustler. He learns sign language while talking to our users. Myself, I come from a deaf family. I did my Master of Engineering in UC Berkeley, where we met with Peter. And this is Skinner, our rock star CTO. 10 years of software engineering, 6 years in mobile experience. But Skinner is also deaf. He only communicates through writing. Can you imagine? He only communicates through writing. So before Transcense, his only alternative was this: a captioner, a person next to him that types everything for him. He has to hire her 2 weeks in advance and to pay her $120 an hour. So no Thanksgiving dinner with somebody else next to you. Can you bring it out with a date? No. So here's the thing. Today, there are 1.7 billion smartphones in the world. On each one of them, there's a microphone right there. And that's what we do at Transcense. We harness this power. Our system connects multiple smartphones in the room together. We use the power of having a distributed array of microphones, speech recognition technologies, and speaker identification technologies to be able to deliver in real time to the deaf person who says what. We built the fastest captioning experience in the world today so that any person with hearing loss can fully engage in a conversation. Anytime, anywhere, because it's right here in his pocket. That's the power of Transcense. So we talked to more than 300 deaf and hard-of-hearing people to come where we're here. And we built the product. It is live, it is in the hands of private users. But more than that, from all over the world, they've been telling us how much they needed this product. So much that in less than 6 days, we made more than $30,000 of pre-sales. So we know we can empower literally more than 5% of the world. And this is a big market, $2.4 billion. But Transcense is also something special. We built a product that solves people's needs. This is a quote of one of our beta testers. Can you find this in the App Store? Can you find those kind of reviews? Carol and all our users are going to be out there talking to 1, 2, 5, 10 people every day in group conversations. And for example, in business meetings, it can provide tremendous value in meeting intelligence as well. You meeting notes taken, actionable. We're also thinking and imagining, being a llama and all of that. What if you would be in a room, in a group conversation, and somebody is Dutch, somebody is French, like me, somebody is Taiwanese, and there's an American. They all speak their own language, but in the same time, you understand them. So that's what we do at Transcense. We try to transcend communication barriers so that you can be right back like this campfire conversation. Thank you.
Okay, so one of the things that we get the privilege of at Wearable World is we have an incubator and accelerator of so far 50 companies this year. We've seen a 90% fund rate, 100% crowdfunding rate from that, and it's all due to the great entrepreneurs that we get to have come here. And the next person on stage is one of my favorites, Noor Sidiqui from Remedy. So Noor, come on up here and show everybody what Remedy's all about. All right, thank you.
Hey guys, so I'm the founder and CEO of Remedy, and I'm going to take a step back actually and talk to you a little bit about the landscape. So, back a little. All right, so you guys have probably heard about Doctor in Demand and HealthTap. So these companies are doing something really, really revolutionary. They're allowing any patient across America to have instant access to a specialist. So at home, you can go ahead and get access to a neurologist, a cardiologist, some of the best in the country. But the thing is that doctors, when you go to an office, when you go to a primary care provider, they don't have access to the same service. So the question is, where is the same ability to have instant access to a specialist for doctors? So that's exactly what we're doing. So doctors also need an easy way to reach a specialist right away. So what happens when you go to the doctor is that they'll have a question, and instead of being able to quickly ask that question to the right specialist, they're going to run unnecessary tests on you. And annually, that accumulates to $2 billion of wasted testing, and of course, your wasted time. And similarly, they have a very strong incentive to, instead of resolving your issue right away in the office, to instead punt the problem. So they send you over, and you're stuck in a queue that's probably 4 weeks long if you're lucky, more likely like 6 weeks if you're in Philadelphia, if you want to see a dermatologist. So why is it so hard to reach the right specialist? And the reason is that a doctor doesn't have a huge Rolodex of every single specialist, and they don't have an idea of, okay, are they available right now? Should I contact their secretary? Should I contact their mobile phone? What exactly do I communicate to them? So 40% of the time when a doctor actually takes that extra effort and tries to reach out to a specialist so that they can answer your medical question in office and right away instead of trying to punt their problem, they fail. So what they need is a way to actually get connected to the right person right away. So this is what Remedy does. Remedy equips the provider on scene with the ability to summarize what's wrong with you, and then we route that case, your case, to the right specialist immediately, so that instead of you having to go set up a follow-up appointment, instead of you having to take unnecessary tests, you have an answer immediately. So I'm going to walk you through a case so right now Remedy's live at 3 hospitals at Harvard, and at Harvard, there's the same problem that is across the entire country, which is that patients are waiting 12 plus hours to see their surgeon because at night, your surgeon's just like you, they go home to their families. But what if you have a complication at night? So Mark is actually a real patient that we were able to treat, and he had Crohn's disease. So he had surgery a week ago, and he woke up in the middle of the night with a lot of pain. And Galen, his physician's assistant, saw him right away. She went in, but she wasn't sure what exactly was wrong with him. Was it an infection? Did he need some antibiotics? Or did he need emergency surgery? But with Remedy, she's not alone. With Remedy, no provider anywhere across the country is alone to answer questions. They have tools in their pockets or that they can use right away to communicate what's wrong with the patient and get help. So with Remedy, the surgeon who's at a distance has the ability to literally do a physical exam right away and weigh in. So this is, instead of the surgeon traveling in the middle of the night to address this case, he's able to do the exact same physical exam right in the office, right from the comfort of his own home. So with Remedy, Dr. Schweitzberg and millions of surgeons across the country are able to provide life-saving advice from wherever they are. And the key thing here is that the future of healthcare isn't just physical. It's not these isolated doctors who have infinite knowledge. With Remedy, doctors are going to be able to have a virtual practice as well, where they're consulting constantly with other physicians, not just in their state, but around the country. So, be part of the future. Thank you.
That's a great job, Noor. So next up, we have Jessica Eisenberg, who is the head of marketing for VoiceItt. Thank you, Jess.
Hello, everybody. Our mission at VoiceItt is to give a voice to the voiceless.
I want to be a firefighter when I grow up. My mom says it's too dangerous, but I think it's only dangerous if there's a fire. I was born 12 weeks before my expected birth date. Is 1.9 pounds heavy or light? I want to speak, but the words remain inside me. People just don't understand me. My name is Ray. I'm 5 years old, and tomorrow I will start speaking freely.
I love you.
Speaking is a basic need. And yet for millions of people around the world, communicating and being understood is not an option. Children with cerebral palsy or autism, adults after stroke, Parkinson's, ALS, it is very hard and frustrating for them because they want to be socially included. And it's not only frustrating for them, it's frustrating for their families, their caregivers, their doctors, and the clinicians who want to help them on a daily basis. They want to do things like buy a bus ticket, get a cup of coffee, or tell a taxi driver what their destination is. Chocolate. Chocolate. And that's where Talkit comes in. We are developing an innovative solution that enables a person with a speech impairment to speak and be understood using only his or her own voice. Let me show you how it works. This is Orit. She is 38 years old. She's living with cerebral palsy. And let's see if you can understand what she's saying.
Now I can start speaking freely.
Does anyone have any guesses as to what she said? Okay. Now I can. No. And this is how Talkit will enable her to communicate freely.
Now I can
Now I can
start speaking freely.
speaking freely.
There are several existing products on the market today for people with speech impairments. Among them are communication boards, head tracking, eye tracking. However, none of these products enable a person with a speech impairment to speak and be understood using his or her own voice. In addition, they can often be very clunky and they're awkward, and they stigmatize the user. Talkit is the only voice-based solution. It enables a person to communicate using his own voice, and it encourages the person to speak, ultimately improving his speech capabilities. According to our market research, there are approximately 10 million potential users in Europe and the EU. And because of our pattern technology, again, this is not standard speech recognition, this is pattern matching. Talkit is language independent and speaker dependent. So our addressable market is approximately $2.4 billion each year at a price point of less than $20 per month subscription fee. We've already established partnerships with associations and hospitals who are excited about our product because it is a disruptive solution on the market. We also have a database monetization B2B strategy, which will help with medicinal efficacy and research for various disabilities, improvement and degradation of speech, etc. We've already established a number of key players who are very excited about our product and are working with us to develop. And we're developing partnerships. Our R&D is based in Israel. We've been in the US for about 4 months, and we've been able to establish really amazing partnerships with an enormous amount of special needs kids that are waiting for our product to come to market. And the past few months have been extremely exciting for us. We've won a number of accolades. And our status to date is we have a running pilot with running code, and we're set to be on the market in about 6 to 8 months. And we have a team of experts, both on the business end and the technological end. Our CTO, Stas Tiomkin, is finishing up his PhD in speech recognition, human machine learning, and he's an industry leader in Israel for speech recognition, as well as our advisory board. Yoav Madan is a world-renowned speech recognition expert, and he's a lecturer at the Technion for about 17 years now. And thank you very much. I'm happy to take any questions. You can just tap me on the shoulder outside.
Thank you, Jessica. Now I'm going to ask our guests to come to the stage. Marco, Kevin, Monisha. And Jessica, as a note, VoiceIt's actually nominated for the MEFGF Awards tonight, or tomorrow night. So make sure that you guys come and make sure that you guys vote. I think it's a great solution. So let's just slide on over here.
Hi everyone, I'm Monisha Perkash. I'm co-founder and CEO with Lumo Body Tech. So today we are a company on a mission to inspire better posture and biomechanics. Tomorrow, our unique motion sensing technology positions us to solve movement problems in a variety of high-growth markets. So just imagine if you could unlock your body's potential by being able to track its biomechanics, getting real-time feedback, and personalized coaching. This is what we do at Lumo. We give your body a voice. The most recent instantiation of our technology is a product called Lumo Lift, which we just started shipping a few months ago. And I'll show you a quick video about it.
What would you do if you were not afraid? Would you stand a little taller? Speak a little louder? Would you run a little faster? Would you live in the moment? This is Lumo Lift. You wear it like a lapel pin. When you slouch, it reminds you to sit and stand taller with a gentle vibration. The Lumo Lift tracks your steps, calories, and distance, and coaches you along the way. The lift connects wirelessly to a mobile application, which tracks your progress. The simple act of pulling back your shoulders and lifting your head helps you look and feel stronger, taller, and more confident. We believe it's the small changes that empower you to do bigger and better things. So you can be fast, stand with pride, be the version of you that you want to be. The Lumo Lift. One move changes everything.
So we're really excited to launch Lumo Lift into the market. It's uniquely positioned to serve both women and men. In fact, I'm proud to say that 50% of our customers today are women, which is unusual for a product at this stage. It tends to be 20 to 30% adoption among women. We're also getting a high volume. We're on track to actually exceed our numbers for the year. We just got distribution through Apple UK, Best Buy, as well as Amazon. And we've been getting broad coverage that transcends both lifestyle, beauty, fashion, as well as business and tech press. But what we really pride ourselves on is building not products, but personalized experiences. Experiences that are integrated into your everyday life. Both on the hardware side, which can be very personalized. The clasp that's worn on the outside of your clothing comes in a variety of designs, shapes, can be customized with corporate logos, with your favorite sports teams, the American flag. And it's also personalized on the software side, and that's where the coaching comes in, where you get real-time actionable feedback that's specific to you. And underneath it all, our data can provide a lot of insights that serves a variety of customers, from consumers, where they get the real-time feedback on coaching, as well as in the corporate market, where posture is intricately linked to back pain. Back pain is the second most leading cause of why people go to the doctor. It's outnumbered only by the common cold. In the workplace, it's the leading cause of disability claims for employees under 45. And then the product also has a lot of application in the healthcare market, where healthcare providers can remotely monitor their patients. In fact, we've gotten a lot of uptick from physical therapists and chiropractors who use this product with their patients. And it's our biomechanical model that's the real secret sauce behind everything we do. It's our set of algorithms that are able to track your body's movements to a very high degree of resolution. We're getting a lot of uptick in the corporate wellness space as well. So this is Daniel Lord. He's the on-site chiropractor at Facebook's Health Center, and he tried out Lumo Lift with some of his patients. And he reported that they had a decrease in daily stress and pain, as well as more energy. And he also said that he thinks it's a game changer, that he'd highly recommend Lumo Lift if you're trying to improve your posture, decrease back pain, or even just trying to stay alert for a business meeting. The market dynamics are ones that you're probably familiar with. It's estimated to be $50 billion in the next 3 to 5 years. I mentioned that posture is scientifically correlated with back pain. Corporate wellness is also a $6 billion industry, where 67% of employers identify poor health habits, such as posture, as leading to significant healthcare costs. And health and wellness are growing trends. We know that by seeing how yoga is really growing. By the way, a lot of our customers tend to do yoga, as well as just the rise of health and wellness apps. So in summary, it's a real honor to be up here on stage with my co-speakers, as well as the ones that came on earlier. It was just really inspiring to see how technology is being used to solve a variety of problems, real problems that as we solve them, they can significantly improve our lives. So thank you for having me up here.